Hi, welcome to the March Medicare Minute. We're leaning into the March Madness this month, and we're going to be discussing penalties, IRMAAs, and the comeback playbook. Trust me, you're not going to want to miss this. My name is Allison, and I'm the ship manager of Baltimore County MD. Myself and my team of volunteers are here to coach you through this Medicare game by providing free, unbiased, and confidential information, counseling, and assist you and your Medicare beneficiaries so you can make the best decision for yourself. Today, our goals are as follows. We're going to have an understanding of what LEPs and income adjustments are. We're going to understand what actions can be taken to avoid penalties and learn who to call when you need support. The penalty zone, late enrollment penalties. So there's two types of late enrollment penalties that you may receive. The Part B late enrollment penalty and the Part D prescription drug plan late enrollment penalty. Before we can draw comeback strategies, we need to understand why the foul was called. What is a Part B late enrollment penalty? Well, this is when you sign up for Part B late. So for each 12-month period you delay enrollment in Medicare Part B, you will have to pay a 10% increase penalty unless you have insurance based on yourself or your spouse's current work. You are eligible for Medicare savings programs, or you qualify for special enrollment period because of exceptional circumstances. For Part D is much the same as Part B, except for the percentage is a little bit different, and then the months that you have are also different. So for Part D, for each month you delay enrollment. So Part B is each 12 months, where Part D is each month you delay your enrollment. You will receive a 1% penalty, and this is a lifetime penalty. You can say if you had creditable coverage or you qualify for the Extra Help program, you may be able to get the penalty waived from you. In most cases, you will have to pay these penalties every month for as long as you have Medicare. If you are enrolled in Medicare because of disability and currently pay a premium penalty, once you turn 65, you will no longer have to pay that penalty, as you're going to be given a special enrollment. So let's check the scoreboard and see how these penalties are going to affect us. For Part B, we're going to use the number of 7. So the foul was that you delayed enrollment into your Part B by 7 years. This means the penalty is going to be 7 years times 10%. Leaving us with this super fun math equation where it's the Part B premium times 1.7, which is the penalty. It's going to bring your total premium for your Part B to $344.93 per month. Part D is very similar, where you are going to have a foul of 7 months. We're going to do 7 months instead of 7 years, so it's a little bit easier for math. So it's 7 months times the 1%, which is going to be 7%. You're going to use the national base premium, which this year for 2026 is $38.99. You're going to times that by the penalty, for our case, 0.07, which is going to be a penalty of $2.73 per month. You're going to see that added to your prescription drug plan premium. Know that that $2.73 does not go to your prescription drug plan itself. That money will then get transferred over to Medicare. So income-related adjustments often can feel like they are a penalty, but it's not. An IRMAA is an income-related monthly adjustment amount. The Medicare income-related monthly adjustment amount is an amount that you pay for being considered a high earner, in addition to your Part B and Part D premium, if your income is above a certain threshold. The Social Security Administration sets 4 income brackets that determine you and your spouse's IRMAA. Social Security determines if you owe an IRMAA based on the income you reported on your IRS tax report 2 years prior. So it's looking back 2 years to see what your income is in order to decide what your IRMAA rate would be. The income that counts is the adjusted gross income you reported plus other forms of tax-exempt income. If you are exempt to pay IRMAA, Social Security Administration will notify you that you have a higher Part B or a higher Part D premium. I want to go ahead and give you the opportunity to look at what the 2026 IRMAA is for Part B. You'll see the brackets here. Once you make $1 over the amount, you're going to see that you're going to have an increased cost for your Part B premium. So it's $202.90 for the everyday person, but if you're considered a high earner, based on these brackets, you will see the increase in your Part B premium. It's very similar to that for the Part D as well, except for because prescription drug plans are different values for a person, what you're going to see instead is a tacked on amount based on your income instead of a total change. So for example, you'll see if you make in this category $109,000 to $137,000, you're going to see an increase in your Part D of $14.50. That's for a single person. So I just want you to be aware of what the IRMAA charts are for this year. So as you're looking, you'll be more prepared. All right, let's take a halftime. We understand what the penalties are now. Let's huddle up and let's start preparing a plan so that we can look at reducing and eliminating these payments. So Part B, LEPs, how are we going to go ahead and move forward with them? I want you to know that everyone has the right to file an appeal with Social Security Administration regarding their LEP determination. To appeal, follow the directions on the letter informing you about the penalty. If you do not have this letter, you can use SSA's request for reconsideration form. You can appeal to remove the penalty if you think you were continuously covered by Part B or job-based insurance. You can also appeal to lower the penalty amount if you think it was calculated incorrectly. Unfortunately, being unaware of the requirement to enroll in Part B is unlikely to be a successful argument for an appeal. However, the following are reasons to appeal that may result in the elimination or the reduction of your penalty. 1, you had a bad job-based insurance during some of your time. 2, you call your former employer or plan and ask for a letter providing that you were enrolled in coverage, making sure to attach that letter to the appeal form. Other forms of evidence include income tax returns that show health insurance premiums paid, W-2s reflecting pre-tax medical contradictions, pay stubs that reflect health insurance premium deductibles, health insurance cards that with policy effective date, explanation of benefits paid by health plan, and statements or receipts that reflect payment of health plan. You were actually enrolled in Medicare Part B during some or all of the period in question. If the penalty is being assessed in error because you were actually enrolled in Part B, you can include proof of that coverage, including a Medicare summary notice, also known as an MSN, showing payment for care statements, showing premiums paid, or other records. You have new initial enrollment period. So if you were on disability and you didn't take Part B early, then you can go ahead and have an initial enrollment period afterwards. Or you are enrolled in a Medicare savings program. The appeal deadline is 60 days from the date you receive the letter informing you about the penalty. If you miss this deadline, you can write a letter explaining why you had a good cause or a good reason, like serious illness, like you were in the hospital, and that's what prevented you from appealing within that 60-day time. If you do this, make sure you attach proof to your letter. Be sure to pay the LEP while Social Security Administration reviews your appeals. If your appeal is successful, you'll be refunded all the payments that you've made, which is great, but you don't want to get stuck behind on the payments. Just like Part B appeals, everyone has the right to file an appeal for their Part D penalty. But instead of going to Social Security Administration, you're going to go to C2C Innovative Solutions regarding your LEP determination. C2C Solutions is the company contracted by Medicare to handle these appeals. In most cases, you have to pay the LEP as long as you are enrolled in Medicare prescription drug benefits. There are, however, some exceptions. For example, if you receive extra help, your penalty will be permanently erased. If you're under 65 and have Medicare, your LEP will end when you turn 65. If you qualify for a state pharmaceutical assistance program, also known as SSDI, it may pay your penalty for you. You can appeal the penalty if you think you are continuously covered, or its amount if you think it was calculated incorrectly. You should complete the appeal form you received from the plan. Attach any evidence you have and mail everything to CTC Innovative Solutions. If you don't have an appeal form for your plan, you can also use this Part D LEP reconsideration request form. Unfortunately, again, being unaware of the requirements to have a prescription drug coverage is unlikely to be a successful basis for your appeal. However, the following are good reasons to appeal and may result in the elimination or reduction of your penalty. If you have extra help, you had creditable drug coverage during some or all of the time of period in question, call your former plan and ask for a letter providing that you were enrolled in the creditable drug coverage. Make sure to attach this letter to your appeal form. Your employer or union may also be able to confirm the fact that you had creditable drug coverage. You had a non-creditable coverage, but you or your spouse were employed, and so you had creditable coverage through their employer. You are ineligible for Medicare prescription drug plans if you are living outside of the U.S. or if you are incarcerated. You couldn't enroll into creditable drug coverage because of a serious medical emergency. The appeal deadline is 60 days from the date you received the letter informing you about the penalty. If you miss this deadline, you can write a letter explaining why you had a good cause or a good reason, like the serious illness, that prevented you from appealing on time. Attach this letter to your appeal. Once your appeal is submitted, you can expect a determination letter from the C2C Innovative Solutions within 90 days. In the meantime, make sure you pay those LEPs to plan along with your premium. If your appeal is successful, you're going to get reimbursed, but it's always good to make sure you're planning ahead. When life changes your income, you can ask Social Security to update the scoreboard. We're going to talk about changing the game, how you can get some relief from the IRMAA redetermination. If Social Security determines that you should pay an IRMAA, they will mail you a notice called an initial determination. This notice should be include information on how to request new initial determination. A new initial determination is received and revised decision that Social Security makes regarding your IRMAA. You can request that Social Security revisits its decision if you have experienced a life-changing event that causes an income decrease, or if you think the income information Social Security used to determine your IRMAA was incorrect or outdated. Again, it's always good to remember that IRMAAs are based on the 2 years previous. Social Security considers any of the following situations to be a life-changing event: the death of a spouse, marriage, divorce. You or your spouse stop working or reduce the numbers of hours you are working. involuntary loss of income-producing property due to a natural disaster, disease, fraud, or other circumstances, loss of pension. You can make the case that Social Security used outdated or incorrect information when calculating your IRMAA. For example, if you filed an addendum tax return with the IRS, have a more recent tax return that shows that you are receiving lower income than previously reported. To request an initial determination, submit a Medicare IRMAA life-changing event form or schedule an appointment with Social Security. You will need to provide documentation of either your correct income or the life-changing event that caused the increase or decrease of income. Slam junk. Eliminating LEPs. These are the strongest offensive plays when it comes to eliminating LEPs. Medicare saving programs help pay your Medicare costs if you have limited income and savings. Additional benefits of enrolling in an MSP include allowing you to enroll in a Medicare Part B outside the usual enrollment periods, eliminating your Part B late enrollment penalty if you have one. Medicare saving plans, MSPs, have income and asset limits, which vary by state. So make sure you contact our office if you're in Baltimore County and you're looking for assistance with MSPs to make sure that you are qualified for those and we can assist you with applying. Contact us for information about this and you may be saving on your Part B LEP. Extra Help is a federal program that helps pay for some to most of out-of-pocket costs on Medicare. Prescription drugs coverage, it is also known as Part D low-income subsidy. The Extra Help program offers the following benefits. It pays for your Part D premium up to a state-specific benchmark amount, lowers the cost of your prescription drugs, gives you a special enrollment period once per month to enroll in a standalone drug plan or to switch between standalone drug plans. Eliminates any Part D late enrollment penalties you might have. You will not have a Part D LEP even if you lose your Extra Help later. If your monthly income and assets were within specified limits, you may be eligible for Extra Help. Even if your income or assets are above the eligibility limit, you could still qualify for Extra Help because certain types of income and assets may not be counted. To apply for Extra Help, call our office or go to Social Security Administration. If you are enrolled in Medicaid Supplemental Security Income, or SSI, or a Medicare savings program, you automatically qualify for Extra Help regardless of whether you meet Extra Help's eligibility requirements. You should receive a purple-colored notification from CMS letting you know that you should apply for Extra Help. Special enrollment defense. It's usually best to enroll in Medicare when you first are eligible or after losing insurance based on current work. If you miss your initial enrollment period, there are certain times when you might qualify for exceptional circumstances, also known as special enrollment periods. An exceptional circumstance is a situation that is unusual or not typical. The following different times would you may qualify for an SEP to enroll in Medicare Part B without penalty. You were implicated by an emergency or a disaster. You got certain types of misinformation from your employer. You were released from incarceration. Your Medicaid coverage is ending. You experience other exceptional circumstances. These SEPs apply to anyone who missed initial enrollment after January 1st. To use the special enrollment period, submit the form CMS 10797 to the Social Security Administration. Learn more about these exceptional circumstances, and contact the SHIP office for more information. This only applies when a bad call comes from a federal source, but it's good to talk about the equitable relief. So equitable relief is a process that allows you to request the following from the Social Security Administration: immediate or retroactive Medicare enrollment, elimination of the Medicare Part B late enrollment penalty. To request equitable relief, you must have failed to enroll in Medicare due to error, misrepresentation, or inaction of a federal employee such as Social Security. Equitable relief does not apply if you were misinformed about your Medicare rights and options by non-federal employees, such as an employer. For example, let's say you did not enroll in a Part B because a Social Security representative said you didn't need to at this time. Because you failed to enroll in Part B and you were given misinformation, you would be able to apply and receive equitable relief. To request equitable relief, you or your representative should write a letter to your local Social Security office explaining that you received misinformation that caused you to delay enrollment. You can find the address of your local office by calling 800-772-1213. Be as specific as possible in your letter and include the name of the representative you spoke to, date and time of conversation, outcome of the conversation, and any additional notes that you may have. You should also indicate whether you want coverage going forward, retroactive coverage, and/or elimination of your Part B LEP. Keep in mind that if you request retroactive coverage, you will have to pay premiums back to the time your coverage began. Social Security is not required to respond to equitable relief requests within any set time frame. They also do not have to send you a formal decision letter in response to your request. Follow up with your local Social Security office around 1 month after submitting your request. You may also want to contact a legislative representative, such as a member of Congress, and ask them to follow up on your behalf. If you are denied equitable relief, there is no formal appeal process, but you can resubmit your request with more or different information as many times as you wish in hopes to get some resolution. Technical fails, billing errors, and fraud. Healthcare providers and their billing departments sometimes make billing errors. These billing errors can be honest mistakes. If you think your doctor or your billing department made an error or mistake, contact them directly first to resolve the issue. You can spot these errors by keeping a calendar of your medical appointments and services, or by calling your local senior Medicare patrol to request a My Healthcare Tracker. You can then compare your appointment services and notes to your Medicare statements. If you have original Medicare, you should receive a Medicare Summary Notice, or MSN. If you have a Medicare Advantage plan and or a Part D plan, you should receive an explanation of benefits, an EOB. If something does not seem right, remember to first call your provider. For example, you may see on your statement that your provider billed Medicare for an office visit on a day when you did not see them. Or you may see that your provider billed you for a service that was different than what you actually received. If your doctor or billing department made a billing error, they should correct it. A pattern of errors made by doctor or other healthcare provider, if not corrected, could be considered a red flag for potential fraud or abuse. If you cannot resolve the issue with your provider, contact your local senior Medicare patrol. They can assist you in trying to resolve the error. The role of SMP also is to help you identify Medicare fraud, errors, or abuse, and help you report potential fraud and abuse to CMS, the correct authorities. Contact information for your SMP is on the final page. So there's lots of ways that you can get assistance if you're looking for more help to get coached through this wild game of Medicare. Here are a few options here. You can contact the Social Security Administration if you have questions about your premiums, including late enrollment penalties or IRMAAs. You can also apply for extra help or equitable relief through your SSA. You can contact them by using the number that's on the screen. You can call the SHIP office if you'd like to contact the Baltimore County office. This is specifically for individuals in the Baltimore County area. You can call us at 410-887-2059 or email us at medicareinformation@baltimorecountymd.gov. If you are looking for assistance through the SHIP office and you live outside of Baltimore County or you live in a different state, you should call the number provided here, 887-839-2675. Of course, we want to make sure you get the information for Senior Medicare Patrol. So make sure if you see any fraud, errors, or abuse, contact your SMP to see if they can assist you navigate it. You can also contact your local Medicaid office if you have limited income and assets. You may be eligible for premium assistance through a Medicare Savings or Medicaid. Contact your local Medicaid office to learn more about these eligibility guidelines. Thank you so much for joining us for this month's Medicare Minute, and we hope that you all have a rockin' month.